My name is Dr. Carl Lebuhn. I'm one of two infectious disease physicians that works at Heartland Cares. I've enjoyed working here since April, well actually since around June of 2000 when I moved to the Paducah area. I've had the privilege to take care of hundreds of patients from Western Kentucky and from Southern Illinois area who have had HIV infection. And one of the very satisfying things about HIV care is that we have treatments now that are highly effective at preserving not only quality of life but length of life. And it's unknown by a lot of people, but that treatment of HIV now is as simple as one pill once a day for the majority of the patients that we take care of. And that one pill once a day basically gives people a very near normal life expectancy, if not normal. And it's well tolerated. There are very few side effects of the medicines we have to offer now. Our biggest challenge is making sure that we've identified people who have HIV infection, that we have created comfort for them in an environment where they can receive ongoing care. Despite efforts from the community, despite efforts on a national level, there still remains stigma associated with HIV infection. Unfortunately, there's not a day or even a week that goes by that I don't see somebody's health care with HIV negatively impacted to some degree because of stigma. And if we could just get rid of some of those problems associated with HIV infection, we could provide care and services to a much larger group of people. It's hard to put into words just how effective this treatment is. I've seen many patients who have advanced HIV infection or AIDS, who have lost tremendous amounts of weight, who are battling cancer or who are battling any variety of infections, who was simply getting on HIV treatment within a matter of weeks to a couple of months or 6 months are back to fully functional, able to go back to work, able to really enjoy a very high quality of life. And unfortunately, because of the stigma associated with HIV, we can't really put up a poster, we can't put up a video sequence of what we see in terms of patients' response to therapy. Otherwise, I think people would be absolutely amazed at what these medicines and what healthcare for HIV can provide. When I was first in training, which would have been the mid-90s, a lot of the care we provided for HIV was in the hospital. The treatments we had to offer were managing or trying to prevent some of the complications of HIV, but it really wasn't treating the HIV infection itself. Starting in the mid to late 90s, they developed newer medicines and a deeper understanding of the pathophysiology of HIV. And basically what was learned is that if the virus is attacked at a couple of different positions in its life cycle, the medicine is much more effective. And so the mortality from HIV drastically diminished in the mid to late 90s and has really only steadily improved since that time as medicines have become easier to take, as they've become easier to tolerate, and as the treatment regimens have become more simple. But the main concept is we're attacking the virus at a number of different points in its life cycle. Pharmaceutical companies have worked together to combine their separate products into single pills. So much of what we have to offer now might be 3 or 4 medicines combined into one single pill, which allows us to aggressively treat HIV with a regimen that might be 1 pill once a day. Treatment of HIV requires really one major factor, and that's a commitment to taking that medicine every day. And a lot of people, when they face problems with housing or finances or insurance or transportation, there are a lot of ways that taking 1 pill once a day can become more difficult. Heartland Cares is an organization that is trying to house numerous different services under one roof. And through that program, we're able to impact people by meeting their needs in a number of different ways, which allows adherence to medication, which allows them to continue one pill once a day without a missed dose. And that opportunity to house different services under one roof is vital to helping make sure that we're providing the best HIV care possible.